Good afternoon, everyone. This is Saru, Arakinas, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. So, what is Tepezza or teprotumumab? Tepezza is an insulin-like growth factor 1 receptor inhibitor indicated for treatment of thyroid eye disease. Teprotumumab or Tepezza mechanism of action in patients with thyroid eye disease has not been fully characterized. It binds to IGFR1R and blocks its activation and signaling. Tepezza comes in an injection, as you see in the image over here. Injection of 500 milligram powder in a single dose vial for reconstitution. Its dosing includes to initiate dosing with 10 milligram per kilogram for the first infusion, followed by 20 milligram per kilogram every 3 weeks for 7 additional infusions. Infusion reactions. If an infusion reaction occurs, it's recommended to interrupt or slow the rate of the infusion and use appropriate medical management. Exacerbation of the pre-existing inflammatory bowel disease. It's recommended to monitor patients with pre-existing IBD for flare of the disease. To discontinue Tepezza if IBD worsens. For hyperglycemia, to assess the patients for elevated blood glucose and symptoms of hyperglycemia prior to the infusion of Tepezza, and continue to monitor while on treatment with Tepezza. For hearing impairment, including hearing loss, the Tepezza may cause severe hearing impairment, including hearing loss, which in some cases may be permanent. Some of the common side effects seen from Tepezza includes alopecia, diarrhea, fatigue, and hyperglycemia. Again, this is a summary information about Tepezza or teprotumumab, which is the insulin-like growth factor 1 receptor inhibitor for treatment of thyroid eye disease. It's an injection, as I mentioned, to be initiated 10 milligram per kilogram for first infusion, and then followed by 20 milligram per kilogram every 3 weeks. For more detailed information on this drug, you should refer back to the package insert, which will give you more information on the dosing, cautions, precautions, and side effects. Again, Tepezza or teprotumumab for treatment of thyroid eye disease. Hope you enjoyed this video. As always, stay safe and take your medications.